Is your hip or lower back pain something that will just go away on its own? Or is it quietly creating more problems for you? Here are some common hip and lower back pain misconceptions. Let's uncover the truth together. Hello and welcome. I'm Sarah Gowans, remedial massage and craniosacral therapist at Blossoming Me and the Healthy Learning Lounge. Here we are a sanctuary for you to tap in to nurture your journey to health, well-being and a positive mindset. We focus on helping you to clear stresses, tensions and blocks that are holding you back from living your most fulfilling life. Today we'll explore 5 misconceptions about hip and lower back pain and why addressing it sooner can help prevent bigger issues later. Problem number 1. Will hip pain go away on its own? Sometimes, actually yes, but often ignoring hip and lower back pain can lead to compensation patterns throughout our body, worsening the problem over time. Sometimes minor aches can resolve with rest and care, but often hip and lower back pain are a signal that something deeper needs attention. Left untreated, it can worsen over time, leading to compensation patterns that affect our knees, lower back, or our posture. For busy parents, it's tempting to ignore it and keep pushing through. But those subtle aches today can turn into chronic pain tomorrow if left unchecked. Misconception number 2. Where is hip pain felt? Hip pain often starts in the groin or deep in the joint of our hips, but many people overlook it until it's spread to the back, our knees or our legs. Hip pain doesn't even always feel like hip pain. It can masquerade as discomfort in our groin, thighs, or even our lower back. Because the hip joint is such a central part of our body, pinpointing the exact location of the pain isn't always easy, especially when the pain spreads to nearby areas. Misconception number 3. Why hip pain occurs. Pain can stem from weak or tight muscles, poor posture, and muscle imbalances. Frequently, doing activities like bending and twisting at the same time and carrying too heavy loads can lead to injuries like repetitive strains and hip pain. Hormonal changes can also play a role. For example, in pregnancy, when hormones like relaxin loosen our ligaments and our hips may become less stable. This can increase the chance of more strain or injury. Emotional stress can also be a factor. Emotions can be stored as tension in our hip area. And also, in TCM, Chinese medicine, the fire element, which is linked to emotions like hurt and betrayal, can show up as tightness or pain in our hips or lower back, as can emotions like frustration and anxiety. Misconception number 4. Fixing or easing hip pain is just about stretching. Addressing hip pain requires a mix of approaches. Stretches, yes, but also strength exercises, mindfulness and relaxing processes. Addressing hip pain isn't just about stretching, it's about building strength, improving our mobility, and releasing emotional tension. Addressing hip pain requires a mix of targeted approaches. Simple steps like incorporating daily hip opening exercises, using a foam roller, or practicing mindfulness breathing can all help ease the tension. Seeking professional help, such as bodywork like massage, craniosacral therapy, osteopathy, and many more, can also help with specific treatments tailored to your needs. Finally, misconception number 5. Connection to the fire element meridians in traditional Chinese medicine, TCM. The hips and lower back pain can be influenced by the fire element. This fire element governs our heart, small intestine, triple heater, and circulation sex meridian channels. When these meridian channels are out of balance, which is often due to stress or heat, very common in summer, then pain and tightness can show up in our hips, lower back, and surrounding areas. Addressing both the physical and emotional aspects then can lead to lasting relief. Studies do confirm that strengthening our hip muscles can reduce lower back pain in up to 70% of cases. Did you know that over 50% of people that have hip pain also experience lower back pain and discomfort within a year? This highlights how connected these areas really are. and why early intervention is key. I hope you found value in today's video, and if you did, please like and share it. And follow us here at Blossoming Me for more insights on relieving your pain and reclaiming your mobility. And join us next time for more tips to nurture your health, well-being, and really support your positive mindset. From my heart to your heart, namaste.